Hi, it's Jason Chaffetz, and time for a Cot-Side chat. The big thing discussion that's going on here on Capitol Hill is the Nancy Pelosi healthcare bill. Here it is, printed out in its totality, all 1,990 pages of it. We're trying hard to get through it. One of my big concerns is that families are hurting out there. They want to have their healthcare costs go down. One of my fundamental concerns about this bill and this approach is that there are literally 111 new bureaucracies, commissions, boards, and programs that are created within this bill. So give me a few minutes. I'd like to read through these, and my point being, do we really think that by adding all of this bureaucracy that we're actually going to drive healthcare costs down? I have serious concerns about that. So hang in there with me. I'm just going to read a list, and we'll provide a hard copy online. It starts with, on page 61, the Retiree Reserve Trust Fund. The Grant Program for Wellness Programs to Small Employers on page 62. Grant Program for State Health Access Programs on page 72. Program of Administrative Simplification as indicated on page 76. Health Benefits Advisory Committee on page 111. Health Choices Administration, page 131. Qualified Health Benefits or Plan Ombudsman, page 138. Health Insurance Exchange as indicated on page 155. Program for Technical Assistance to Employees of Small Businesses, Buying Exchange Coverage on page 191. Mechanism for Insurance Risk Pooling to be established by the Health Choices Commissioner on page 194. The Health Insurance Exchange Trust Fund, page 195. The State-Based Health Insurance Exchanges on page 197. Grant Program for Health Insurance Cooperatives, page 206. Public Health Insurance Option, page 211. Ombudsman for Public Health Insurance Option, page 213. Account for Receipts and Disbursements of Public Health Insurance Option, page 215. Telehealth Advisory Committee, page 589. Demonstration Program providing reimbursement for, quote, culturally and logistically appropriate services, end quote, page 617. Demonstration Program for Shared Decision Making using Patient Decision Aids, page 648. Accountable Care Organization Pilot Program under Medicare, page 653. Independent Patient-Centered Medical Home Pilot Program under Medicare, page 672. Community-Based Medical Home Pilot Program under Medicare, page 681. Independence at Home Demonstration Project as allocated on page 718. Center for Comparative Effectiveness Research on page 734. Comparative Effectiveness Research Commission, page 738. Patient Ombudsman for Comparative Effectiveness Research, page 753. Quality Assurance and Performance Improvement Program for Skilled Nursing Facilities, 784. Quality Assurance and Performance Improvement Program for Nursing Facilities, page 786. Special Focus Facility Program for Skilled Nursing Facilities, page 796. Special Focus Family Program for Nursing Facilities, page 804. The National Independent Monitor Pilot Program for Skilled Nursing Facilities and Nursing Facilities, page 859. Demonstration Program for Approved Teaching Health Centers with respect to Medical GME, page 933. Pilot Program to develop anti-fraud compliance systems for Medicare providers, page 978. Special Inspector General for Health Insurance Exchanges, page 1000. Medical Home Pilot Program under Medicaid, page 1058. Accountable Care Organization Pilot Program under Medicaid, page 1073. Nursing Facility Supplemental Payment Program, page 1106. Demonstration Program for Medicaid Coverage to Stabilize Emergency Medical Conditions in Institutions for Mental Diseases, page 1149. Comparative Effectiveness Research Trust Fund, page 1162. Identifiable office or program within CMS to, quote, provide for improved coordination between Medicare and Medicaid in the case of dual eligibilities, end quote, page 1191. Hey, don't worry, we're on number 41 and we got to get to 111. So hang in there with me. Center for Medicaid and Medicare and Medicaid Innovation, page 1198. Public Health Investment Fund, page 1214. Scholarships for service and health professional needs areas, page 1224. Program for training medical residents in community-based settings, page 1236. Grant program for training in dentistry programs, 1240. Public Health Workforce Corps, page 1253. Public Health Workforce Scholarship Program, page 1254. Public Health Workforce Loan Forgiveness Program, page 1258. Grant Program for Innovations in Interdisciplinary Care, page 1272. Advisory Committee on Health Workforce Evaluation and Assessment, page 1275. Prevention and Wellness Trust, page 1286. Clinical Prevention Stakeholders Board, page 1295. Community Prevention Stakeholders Board, page 1301. Grant Program for Community Prevention and Wellness Research, page 1305. Grant Program for Research and Demonstration Projects related to Wellness Incentives, page 1305. Grant Program for Community Prevention and Wellness Services, page 1308. Grant Program for Public Health Infrastructure, 1313. Center for Quality Improvement, I have no idea what that does, but that's on page 1322. Assist Secretary of Health Information, that is page 1330. Grant Program to support the operation of school-based health clinics, page 1352. Grant Program for Nursing Managed Health Centers, 1361. Grants for Labor Management Programs for Nursing Training, page 1372. Grant Program for Interdisciplinary Mental and Behavioral Health Training, page 1382. No Child Left Unimmunized Against Influenza Demonstration Grant Program, 1391. Healthy Teen Initiative Grant Program regarding teen pregnancy, 1398. Grant Program for Interdisciplinary Training, Education, and Services for Individuals with Autism, page 1402. University Centers for Excellence in Development of Disabilities Education, 1410. Grant Program to Implement Medical Therapy Management Services, 1412. Don't worry, we're on number 69 now. Grant Program to Promote Positive Health Behaviors in Underserved Communities, 1422. Grant Program to State Alternative Medicine Liability Laws, 1431. A Grant Program to Develop Infant Mortality Programs, page 1433. Grant Program to Prepare Secondary School Students for Careers in Health Professions, page 1437. Grant Program for Community-Based Collaborative Care, 1440. Grant Program for Community-Based Overweight and Obesity Prevention, page 1457. Grant Program for Reducing Student-to-School Nurse Ratio in Primary and Secondary Schools, 1462. Demonstration Project of Grants and Medical Legal Partnerships, page 1464. Center for Emergency Care under the Assistant Secretary of Preparedness and Response, page 1478. Council for Emergency Care, page 1479. Grant Program to support demonstration programs that design and implement a recognized emergency care system. Regionalized emergency care systems, page 1480. Grant Program to assist veterans who wish to become emergency medical technicians upon discharge, page 1487. Interagency Pain Research Coordinating Committee, page 1494. National Medical Device Registry, 1501. Class Independence Fund, page 1597. Class Independence Fund Board of Trustees, page 1598. Class Independence Advisory Council, page 1602. Health and Human Services Coordinating Committee on Women's Health, page 1610. National Women's Health Information Center, 1611. Centers for Disease Control, Office of Women's Health, page 1614. Agency for Health Research and Quality, Office of Women's Health and Gender-Based Research, page 1617. Health Resources and Services Administration of Office of Women's Health, page 1618. Food and Drug Administration, Office of Women's Health, 1621. Personal Care Attendant Workforce Advisory Panel, page 1624. Grant Program for National Health Workforce Online Training, 1,629. Grant Program to disseminate best practices on implementing health workforce investment programs, page 1,632. Demonstration Program for Chronic Shortages of Health Professionals, page 1,717. Demonstration Program for Substance Abuse Counselor Education Curricula, page 1,719. Program of Indian Community Education on Mental Illness, page 1,722. Intergovernment Task Force on Indian Environmental and Nuclear Hazards, page 1,754. Office of Indian Men's Health, page 1,765. Indian Health Facilities Appropriation Advisory Board on 1774. Indian Health Facilities Needs Assessment Work Group, page 1,775. Indian Health Service Tribal Facilities Joint Venture Demonstration Projects, 1,809. Not a whole lot of specificity there. Urban Youth Treatment Center Demonstration Project, page 1,873. Grants to Urban Indian Organizations for Diabetes Prevention, page 1,874. Grants to Urban Indian Organizations for Health IT Adoption, page 1877. Mental Health Technician Training Program, page 1,898. Indian Youth Telemental Health Demonstration Project, page 1,909. Program for Treatment of Child Sexual Abuse Victims and Perpetrators, page 1,925. Program for Treatment of Domestic Violence and Sexual Abuse, page 1,927. Native American Health and Wellness Foundation, page 1,966. Committee for the Establishment of the Native American Health and Wellness Foundation, as found on page 1,968. At the end of the day, it's about openness and transparency. I would think that the more sunlight that this behemoth got, the more support there would be. But I think the more we look into this program, the more questions there are. How we're going to pay for it, how much it's going to cost, what are each and every one of these programs actually going to do? And this bill is going to be slammed through in the cloak of darkness, and I just want to make sure that everybody's understanding the gravity and the totality of this, let alone dive into the details of what all of this bureaucracy is going to mean to being able to take care of your kids, your parents, and yourself. Because at the end of the day, it's all about trying to drive down healthcare costs, not build up the government bureaucracy of the things I just read.